What are the treatment options for recurrent pregnancy loss? A positive pregnancy test, a heartbeat on the screen, a dream taking shape, and then silence. Loss again. For couples facing recurrent pregnancy loss, the emotional burden is overwhelming. Every loss brings not only grief but also fear. Why is this happening? Is there something we are missing? Will we ever hold our baby in our arms? If this sounds familiar, please know this. You are not alone. And more importantly, there is help. I am there to talk about treatment options for recurrent pregnancy loss, also known as RPL. What causes it, how we treat it, and why hope is very real when science leads the way. So, understanding recurrent pregnancy loss. Recurrent pregnancy loss is more than just a streak of bad luck. It is a medical condition that needs investigations and care. When a woman experiences 2 or more consecutive miscarriages, it's time to pause, reflect, and assess because often there is an underlying reason, or there may be many reasons contributing to these heartbreaking outcomes. At our center, where I work along with Dr. Mohan Raut, we believe that no two cases of RPL are the same. That's why a thorough and individualized evaluation is the first step. Now let's look at some of the known causes. Genetic abnormalities in either partner may affect embryo development. Hormonal imbalances like low progesterone can stop a pregnancy from progressing. Structural problems in the uterus can also hinder implantation or fetal growth. Blood clotting disorders can impair blood flow to the placenta, and sometimes the immune system itself may reject the pregnancy. That's where we begin with a comprehensive diagnostic process, one that goes beyond surface level and tests to uncover the true root of the problem. Medical treatments are tailored to the cause. Once we understand why the losses are happening, we can begin to treat them. At our center, we don't believe in one-size-fits-all solutions. Each treatment is carefully chosen based on what your specific body needs. Let me walk you through some of the treatment options. If the issue is genetic, we offer detailed genetic counseling. In some cases, pre-implantation genetic testing during IVF is advised and it can help to select healthy embryos. If it is hormonal, we may prescribe progesterone supplements to support the early phases of pregnancy and stabilize the uterine lining. If we discover structural problems such as uterine septum or fibroids, a minor corrective surgery can dramatically improve your chances. For blood clotting disorders, low-dose aspirin and blood thinners like heparin can help maintain proper blood flow to the baby. But remember, these treatments are only as good as the diagnosis behind them, which is why a detailed evaluation is the true foundation of healing. The important role of reproductive immunology must be understood. So now let's talk about an often overlooked but critically important aspect of RPL, the immune system. Sometimes our own body may misidentify the embryo as a foreign invader and attack it. It sounds harsh, but it is a reality we see often in our work. This is where reproductive immunology plays a key role. It's a specialized field that studies the complex relationship between immune system and pregnancy. At our center, we specialize in exactly in this. We use immunological testing to uncover issues by doing tests like natural killer cells, HLA cross-match, and TNF-alpha, and then we treat these couples using proven immunological protocols. Treatment options may include Immulit treatment, low-dose aspirin to improve blood flow, corticosteroids to suppress harmful immune responses, and even intralipid infusions to restore the immune balance. These therapies don't just suppress symptoms, they reprogram the immune system to support rather than sabotage a pregnancy. And the results? The hope is restored, pregnancy is sustained, baby is born. Lifestyle changes and supportive care is also important. But it's not only about medicine. Your body is the home where this baby will grow. So taking care of it is equally important. We encourage our patients to make thoughtful lifestyle changes that enhance treatment success. Eat a balanced, nutrition-rich diet that supports hormonal as well as immune balance. Maintain a healthy body weight, as both underweight and overweight status can impact fertility. Quit smoking and avoid alcohol, as both are known to increase miscarriage risk. Manage stress well, because chronic stress affects both hormones as well as immunity. And then there is the emotional side of this journey. Couples facing recurrent pregnancy loss are often emotionally exhausted. That's why we offer even supportive treatment to them and psychological care through trained professionals, because healing the heart is just as important as the healing of the body. Continuous monitoring and follow-up care is also important. Treatment doesn't end once you get that positive test. In fact, once pregnancy is achieved, it's just the beginning of a delicate phase that needs absolutely careful monitoring. At our center, we ensure personalized care so that no red flag goes unnoticed, and that you are never left alone during this deeply emotional time. It's a relationship, not just a prescription. Our patients often tell us how much it means to have a team they trust, walking with them week by week until they safely reach that long-awaited delivery room. So in conclusion, hope is not lost. So, what is the takeaway here? Recurrent pregnancy loss is not the end of the story. It is a signal, a call to look deeper, to seek answers, not just accept defeat. At our center, we bring together science, compassion, and personalized care. With reproductive immunology, advanced diagnostic, and a whole person approach, we have helped hundreds of couples rewrite their stories from loss to life, from dreams to cradle. If you have experienced 2 or more miscarriages, don't wait. Reach out. We are here to listen, to guide, and to walk this road with you every step of the way. Because every heartbeat matters and every couple deserves the chance to bring their baby home. Visit us on www.icprm.in or call us on our helpline number 9833201522 to schedule your consultation. And you can follow us on Instagram and Facebook also. Thank you.